This is another interesting panel, and this is one panel that I look forward to in all the conferences that we do, where we are able to do something which is very, very different than what you would expect in a healthcare conference. And everyone sitting here is sitting here for a reason. You know, we are living in India, we're living in a country where astrology and traditional sciences have been believed in and have been used, and we have suddenly seen the comeback of traditional sciences aligned with things like education and astrology today, and there we are seeing a lot of startups in this space coming in. So there's a revival of these sciences, or understanding the importance of these sciences. So Dimpi ji is representing that. All of us have challenges in life. There's no one I've come across who doesn't have challenges in life. And we've realized, especially after pandemic, that, you know, mental well-being is of prime importance, and a lot of it relates to relationships, whether with self or with people around you. So we have Rachna, Dr. Rachna talking about that. Pallavi ji is actually creating an environment where modern sciences as well as traditional sciences can be combined, and actually at the ground level we can impart these sciences together for an outcome that we can create for the patient. And apart from the pedigree that Sir has, you know, Dr. Pandav is not just here because he's a successful healthcare practitioner, somebody in the industry, but he's here for what he's done for himself. He's been dealing with Parkinson for some time, and I met him about 10 days ago, and he told me, Harbinder, you know what, 90% of my problem is solved because of integrated healthcare solutions. So he's a testimony of somebody who's benefited from this. So there's a reason why everybody's sitting here. Sir, my first question would be to you. You've had Parkinson's, and you say that you found significant improvement, and you owe a lot of it to your integrated approach to treatment. Can you share how did it help? Can you share very briefly what your story is, so that our belief in integrated health can go up?
Thank you very much. Before I answer your question, Harbinder, if you break up spelling, it's Har and Binder. That's why we are all here. We are bound to him.
Thank you, sir. Thank you, sir.
Harbinder. सबसे पहले मैं जब भी whenever I go to any public function, I express gratitude to 4 types of people. First, gratitude to the defense services, Army, Navy, Air Force. Dr. Lal, रात को आप आराम से सोते, क्योंकि 24 घंटे वहाँ हमारे डिफेंस फोर्सेस आर अवेक 24 आवर्स. तो ग्रेटिट्यूड टू देम. सर, जो बात कर रहे हैं आपसे विनंती है, नम्र विनंती है, प्लीज़. नंबर 2, द कोरोना वॉरियर्स. COVID-19 was a great disaster, great invasion on our country. उसमें फर्स्ट वेव में, डॉक्टर लाल प्लीज करेक्ट मी, 700 डॉक्टर्स लाइड, 700. सेकेंड वेव 750. माई ग्रेटिट्यूड टू द डॉक्टर्स हु सैक्रिफाइस देयर लाइफ, द सपोर्ट स्टाफ, the nurses, the pharmacists, the security, the ward boys, the ambulance drivers. Unko dhanyawad. I think Bharat Sarkar has a scheme that they give 50 lakhs rupees to the family of the deceased. But it's our duty to give them. We have already given the financial part. What about the emotional part? Losing a father. Number 3, gratitude is to all of you. There's something called, I'm an economist. In fact, India's first trained health economist from McMaster University in Canada. There's something called an opportunity cost. Instead of sitting in this hall, you'd be doing the next best thing. So हम आपको धन्यवाद देते हैं सबको. Now the answer to your question is very simple, sir. Can you repeat it for me?
So how did you use the integrated health as an approach to help you yourself come out of this problem or to solve it to a very large extent?
Two answers to your question. Number 1, Guru. जैसे मैंने बताया ना, गुरु ब्रह्मा गुरु विष्णु गुरु देवो महेश्वरा गुरु साक्षात परब्रह्म तस्मै श्री गुरुवे नमः. मेरे ज़िंदगी में मैं जहाँ तक यहाँ कुर्सी पे बैठा हूँ, हरविंदर आज दोपहर को गुरु का आशीर्वाद रखा. Mother ji was the first guru, mother, father. Mother is also the first truth of life. I was very fortunate to get good gurus at all the time in my life. That's number 1. Number 2, I'm a great fan of Swami Vivekananda. Can you read what's written here?
Believe in yourself.
Believe in yourself. So I had the Guru's blessings and I believed in myself. That's why where I'm here. You'll be surprised to know that I take 30 medicines, 30. Uski list hai, sir. I would suggest you print my article. 30 medicines I take from morning and evening. Mr. Baldev, he is with me since last 26 years. During COVID-19, I sailed through that period. I started having my Parkinsonism from the year 2006. Sir ji, please. Sir, आपके पैर छूना चाहता हूँ मैं. 2006, early symptoms of Parkinsonism. 2016, it became so florid that I couldn't get down from the chair. I required 2 people to make me get up from the chair. And even I could not eat with my hands. That was a bad stage. 2020, I started my treatment. Neurologist Dr. Ajay Srivastava, psychiatrist Nanda Kumar from the All India Institute of Medical Sciences, New Delhi. Both of them are my students. So 4 years I've been taking integrated holistic medicine. That has made all the difference. Later on, I'll come back to you in more details.
Great, sir. Thank you so much, sir. You know what, it took me a lot of courage to actually put this panel together, because to talk about things which otherwise are not expected in the healthcare system, people look at you कि healthcare के conference कर रहे हो, modern medicine की बात कर रहे हो, और ये बीच में कहाँ से लेके आ रहे हो. What he's just said just amplifies my belief, because just day before I started reading a book which is an autobiography of Dr. Lal, and I was just telling him the most powerful message in the book is in the preface itself, where he's explained the power of spirituality, because everyone, including the healthcare professionals, sometimes need a guru, a mentor who can help you take the courage to do something which otherwise would seem difficult. So, just amplifies my thought process which I'm developing. I've just taken my first step in spirituality. I'm still learning. Dr. Pallavi, when you set up this institute, which is environment to create integrated medicine, both the modern form as well as with the traditional, was it just a great business opportunity, since for the last few years everybody's talking about this, or was there some strong underlying belief after you had been running Kailash Hospital that prompted you to take this step? How true are you in your efforts that you're making in now?
First of all, like you said, that this topic being taken up for discussion is evidence enough that people have realized this later. So obviously, this institution that I'm talking about that we run, I would say that we started in 2008. And that was back when nobody believed in Ayurveda, naturopathy, nobody was talking about it. But our founder chairman, sir, Dr. Mahesh, who's also the member of parliament, he somehow had a very strong belief, though being her allopathic practitioner himself, he always, because he always taught us that empathy is very important. And when I see, because he's spiritually also very aligned, so whenever he was treating a patient himself, and though he was a pediatrician, but he got patients for orthopedics and neuro and everybody coming to him, because the one connect that a patient has to his doctor is that of faith. And he said that I have seen during my practice that when I treat my patient and when I give him that faith and I keep that hand on his shoulder and say, you'll be fine. When I give him that mental support that, okay, I'm there with you. And when I tell him that even if he's in the ICU, he can take the name of whatever Lord he believes in. And that helps him heal better. And what we are referring to as alternative medicine, which is a 5,000-year-old practice that we are fortunately inherited from our great ancestors, is nothing but what mostly describes preventive health. Back then, they were not talking about advanced surgeries, they were not talking about AI, they were not talking about robotics. They built this on the very thought of creating a healthier community, a healthier society. So all of those people, they were not called doctors back then, they were rishis. They had studied the Vedas, and that's where this originated. But the very concept lies in the fact that, treatment is okay, but prevention is a very big important part that the society needs to understand. And actually, if you, I'm not an Ayurveda expert, but as much as I've, ever since I myself lately started believing in all of these things, because you see and you believe. And for somebody of our age, these things are not very relatable to. But when you see and hear those stories every day, you start believing that. So back then in 2008, it is kudos to his efforts that he thought that no, there should be a branch, but it was never, it was always like, okay, this is allopathic and this is Ayurveda. There was never that link. It was always running as a separate institute, saying, okay, you have an interest in this, fine, you are free to follow this. You have an interest in allopathy, you follow this. Very lately, I think post-COVID, where people started talking, our Kada started getting famous and all that across the globe, that's when people started seeing that, see, we are talking about treatments, yes, but looking at the global perspective, let's talk about the bigger issue, that is how to create a healthier community. And when I'm pitching my healthcare to the global world, why not portray myself as a beautiful fusion of tradition and technology when I have it? Others are not lucky enough to have it. Country like China has it and they portray it. So that's when I think lately we all started realizing that, and it's still in that process, that we are now in that process to trying to bring together those two things. But yes, at the inception, it was a very initial beginning because of his beliefs in it, and he said that let's have it. But I'm happy that back in 2008, and it's running as an NABH accredited center. Kudos to and this change even is also the ministry and the government is responsible, because somewhere that notion and that thought has come in their mind that this has to be given importance. It is neglected, and when we add it, I'm going to get better outcomes. So that has helped. But back then, of course, it was not revenue related because it hardly had any footfall. But it was just there so that people have that spectrum. Today, it's a complete one.
Absolutely. Thank you so much for doing this. And, one is, I love the term healer, rather than a doctor. In healthcare, whether we like it or not, the reality is that the doctor who's treating is a human being. The patient is a human being. The caretaker is a human being. So we're dealing with human life, And there are two things that are a reality to human life. One is the power of observation. Whether we like it or not, whether we want to see it or not, we are observing all the time. And the second thing is what you use the term faith. And I strongly differentiate between the trust that we have in the system versus the faith that we have in the system. And when we are looking at faith, and in traditional sciences, you cannot ignore the belief that we have in astrology. And a lot of people have started going to an astrologer before planning their delivery. you know so Dimpi ji, my question to you is, in healthcare we are dealing with doctors, we are dealing with people working in a hospital environment. They are all very, very highly educated people. How can the educated community come together and work towards building a faith? I mean, I'm coming out of the book on cancer, and one of the things that has strongly emerged out of my conversations with over 20 people that I've had, each one a master in their own field, is that डॉक्टर जो कर रहा है मेडिसिन का इफेक्ट तो है, लेकिन वो तभी काम करता है जब फेथ होती है. ठीक है ना? एस्ट्रोलॉजी कैसे इन सब के साथ एजुकेटेड लोगों के साथ इकट्ठे मिलके काम कर सकती है? व्हाट इज द रोल दैट इट कुड प्ले इन हेल्थ केयर?
First of all, a wonderful thank you to Dr. Abhisena, who's introduced me to this world, and then of course to Dr. Narula, who's given me this platform. And the other thing is, if I can use the term intelligent rather than educated. One can be educated and not be intelligent. I'm sorry if I'm offending. But the thing is, cancer, especially because you're talking of cancer, cancer has been mentioned in astrology as Kark Rog. There is no book of astrology where Kark Rog is not mentioned. Rest, Dr. Pandav has said everything, Dr. Pallavi has said it. There is only a little bit of more changes that we want to do. How to not introduce, because it is already there. There are so many things in the world which are there but we are not using, or we may not know of, but that doesn't mean it does not exist, or it is not valuable, or it is not applicable. So all combined together is definitely more effective. I've yet to see a hospital without a small temple. Where if it's a Christian hospital, then you have a prayer room. I haven't seen one. In fact, even if you go to the courts, there is a temple nearby. So, and in my own case, I'm very sure I'm too much of a small memory for Dr. Lal. 40 years ago, he was standing in his laboratory at Connaught Place. I'd taken my son for a blood test because I'm a thalassemia minor patient, and my son was very weak. And I crossed the Gurdwara, Bangla Sahib. At that point of time, 500 rupees was like 50,000 for me. So I just cried and I prayed, it should not be transmitted to him. And Dr. Lal himself, as the baby was crying, he took the blood test. और इन्होंने उसके सिर पे हाथ रखा, बोले नहीं होगा, मत चिंता करो. And the report was negative. So, blessings, prayers, wishes, good wishes, everything works. And like I was just explaining, that we have two divisions which you have already, I think, spoken about the word healer. A doctor needs to be a healer more than a doctor. And the moment a patient sees a doctor, he should feel convinced, and I think 40% of the disease goes by the trust and then follows with faith and medicines. So it's always a combination. Not always that a husband-wife relation where the doctor, mother, child, teacher, student, everywhere there has to be some connection somewhere. Now when that connection is not there, we can check on with the form of planets that is it something wrong with the planets or something can be improved. So here the role of planet comes, and it's such a vast subject that 100 hours is also not enough for discussion. But that is why I say it's for the intelligent. because you have to reach a certain level, because astrology is an extension of astronomy, and astronomy only an educated person can understand.
That's brilliant, Dimpi ji. You know, first of all, I think there is power in the words. ठीक है ना? So I was in a cancer meetup just few days ago, and they asked me what survivor are you, because they assumed that every person in a cancer
Yeah.
group would be. You are also there, Dr. Rachna. You know, is a survivor, and I was telling them jokingly that, you know, I'm surviving the survivors sitting here. So आपने मेरे को doctor बोला, मैं भी I'm a doctor who's not a doctor but surrounded by doctors.
No, that's
So,
that's a bigger doctor.
अब मेरे को कोई ना कोई institute has to give me an honorable doctorate for me to be
No,
called
no,
a doctor.
but by the way, I'll just tell you, जब पुराने ऋषि मुनि जैसे इन्होंने बोला था, उनके पास ज्योतिष कोई पढ़ने जाता था, तो उस टाइम कहावत ये होती थी कि जो ज्योतिषी का पंखा झलता है ना, वो ज़्यादा सीखता है ज्योतिष स्टूडेंट से ज़्यादा, क्योंकि वो ज़्यादा सुन लेता है. सो जितना आप जानते हो, आप सबका ऊपर का क्रस्ट ले लेते हो.
ठीक है, मैं बहुत बड़ा क्वैक बन गया हूँ यहाँ पे. Dr. Rachna, let me come to you. देखो, you know, whenever we are dealing with any disease that is there today, हम diabetes ले लें, BP ले लें, cancer ले लें, at the end of the day, at least the conversations that I've had with the experts, everything boils down to कि यार stress मत लिया करो. Stress is leading to this, stress is leading to that. If stress is the root cause of everything and every problem that most of us are dealing with, why is it not the part of a healing process when we are dealing with these diseases? Except for cancer, I don't see mental well-being formally being put in as a part of the treatment process. What do you think needs to happen?
Thank you so much for having me, Harbinder, and thanks for such a wonderful panel and everybody listening. So I'm going to drag this a little back behind. So I'm a homeopath by graduation, and my postgrad is in psychology. Now, like exactly what she said, that, you know, it's this integrated system of medicine. If I were to just drag back us a few minutes behind, Harbinder, what is integrated system of medicine? मैं अभी mental wellness पे भी आ जाऊंगी. So when we are talking about, you know, even if you open the WHO, the first thing they'll say after a little while is that 80% of the people, the entire population of the world, follows some indigenous system or the other as an adjunct therapy. मतलब 80% लोग are following some adjunct, whether Chinese traditional medicine ले लीजिए, कहीं पे भी कुछ ले लीजिए, reflexology ले लीजिए, acupuncture, acupressure, Tibetan medicine, it's endless, right? So of course our roots as India go very, very deep rooted into this system. Allopathy has only come a few hundred years ago, and it's a pharma which has pushed it in. But if I were to go back, and of course now we see with the Ministry of Ayush coming in, right? So I'm talking way back in the day. So integrated system of medicine basically primarily means that you can use any one of these systems along with the modern medicine system for the method of healing for any particular illness or in the preventive form. So आप आयुष का पूरा ministry ले लीजिए, that came into very much into being into 2014. Then Modi ji pumped in a lot of money, because I'm sitting in a BW conference, so economy की तो बात हो नहीं सकता कि ना करें. So it was close to 4,000 crores which was put in there, right? So having said that, that is a kind of importance which was pushed into the system. If you see worldwide today, 2023, 2024 figures are showing somewhere close to, I think, $100 billion industry hai, just the Ayurveda side of it, just the Ayurveda side of it worldwide. So look at how this wasn't there and has gained prominence just because we do realize that how important it is to take care of any human being from the holistic perspective. Means a 360-degree approach, which means your mind, body, soul, or your spirit. And all of us are sitting here professing not only just that, but also a deeper sciences like the power of prayer. Abhi, I think sabne yahi cheez cumulatively boli hai. Then we also have esoteric sciences which we cannot leave behind, which is Ayush doesn't include esoteric sciences, but esoteric sciences जो कि अब कुछ देर में वो भी include हो जाएंगी, which is astrology, which is Reiki, pranic healing, Lama Fera. There are tons of healing mechanisms available. What is it? all of them exist, and all of it has a component of the mental wellness. So there is no human being who can be in complete health unless we are sound in mind, body and spirit or soul, right? And that is what is the integrated system of medicine. Our mental wellness has come very much into the forefront. Why only mental wellness? Wellness as a whole category, which is a six-pronged approach, not even mind, body, spirit, also the spiritual side of it, the side of the social wellness, the occupational wellness. All this becomes, if we are not well in most of these, we are not well as a person. I could be having the best body possible, but if my mind is not all right, if my intentions are not okay. Today we are all talking about the power of manifestation from the west till here. Originate to idhar se hi hua hai, right? So we can't put that behind, and like how the Ayush ministry has taken over and come up with so many forms of medicine which they have finally actually become mainstream, so will mental wellness also come into.
Thank you for bringing this point in terms of why we should talk about wellness. I think, instead of wellness also we should talk about well-being, because wellness is also, I think, come somewhat hinting towards becoming well, whereas well-being is more towards remaining well. So you don't have to be ill to work towards it. We have the times up, but we're going to take one question each. So the only request is just keep it very short, sir. So you are a very well-respected professional in the healthcare industry. You've already made a lot of difference. What is it, through your experience and of the industry as well as your personal experience, you can do to create this movement towards integrated healthcare?
I will give a practical example. Where medicine fails, music heals.
I think, this is the perfect example of getting an answer without speaking a word.
Yeah, he's given you an
He's
answer
given you
without
a
a word.
practical. I've known Dr. Pandav from last couple of years, and I know that last time we met almost like a year ago, it was difficult for him to stand up from his wheelchair. So, fantastic, sir.
And Harbinder, you have the answer for mental wellness right here.
Right.
That any couple of minutes can make you feel so happy, right? So what are we dragging ourselves down into so many things? So that is what when doctor says stress hai. So this is the answer that, there are so many people just ask us one thing every 1 hour. I have somebody ask me, what is a stress busting mantra? Do cheeze bata do, kuch to bata do. It is yours. What makes you happy, what makes him happy is his music. So important to be in sync with yourself, to know what helps you bust the stress.
तो आपने अपने अगले क्वेश्चन का आंसर पहले दे दिया.
Yeah, but
ठीक है ना?
even
So मैं अगला क्वेश्चन आपसे
even
नहीं
no, even I'll answer it without you questioning it,
हाँ.
We are also
because
inspired by him, no?
why reach to a point where you will have to find an answer how to have a stress buster. The number one is the society, all the society pressures, and not to forget, we've spoken about everything. You can go to the best hospital, number one doctor, number one X-ray machines, everything is there. But if you don't have the right food, nothing will help you. And right food, right environment. What you are growing, जैसा खाए अन्न, वैसा रहे मन. ठीक है?
Fantastic.
तो अब अन्न ही हमारा बेकार है, ऑल पेस्टिसाइड वाला है. सो अब ये जो पॉइंट है उसको भी ये मगा फाउंडेशन टच कर रही है कि जितनी मेरी हिम्मत हुई मैंने उतना ही कर दिया है.
बिल्कुल. I mean, there's a very strong message.
और एक टाइम आएगा जब आप बिल्डिंगों को देख देख कर रोओगे क्योंकि वो रोटी नहीं देगी आपको.
नहीं, बिल्कुल ठीक बात है मैम. आपकी ज़िंदगी से तो हमने एक चीज़ सीखी है कि you don't have to have everything in place to be able to make a difference. You start where you are with what you have.
I believe in if you see it, just do it.
Fantastic.
Don't wait for something to happen. And the other thing is, I'm so honored that I have just the name written on the board, nothing else behind that. But I'm so honored with so many Padma Shrees around me. I have a guarantee that next birth कोई 1-2 डिग्री तो मेरे नाम के साथ भी लगेगी. 100%. इतनी तो छूत की बीमारी मेरे को लगी जाएगी. And the other thing is that you can all treat yourself. Now me being number one uneducated, number two being very poor, from the background. And number 3, a 6-time heart attack patient without going to the hospital, I'm still sitting here.
Fantastic. You know, I want to ask one question to Pallavi ji, and you know, this is a burning question which I've always come across whenever we have discussed traditional sciences. कि ठीक है आयुर्वेदा काम करता है लेकिन इमरजेंसी में जाते हैं कुछ चीज़ें हैं वो तो सर्जरी से ही होंगी उसके लिए तो मॉडर्न मेडिसिन चाहिए ही चाहिए. Having an institution which is offering both or a blend of both, how do you choose what is going to work on which patient and what is the best thing for them, because they're coming to you with faith that you will do what is right for them. You know, so how do you choose without compromising one over the other?
That is a very important question because of lately we have some people, you know, making stark remarks and claims that we can treat this. So that very thing needs to be corrected. Okay, first, we are not quarreling amongst ourselves for the patient. We are all looking at, we have to heal the patient. And obviously, even a practitioner, an Ayurvedic practitioner would not say if you have a stroke or a cardiac arrest and you don't have to run to an acute emergency. You have to, that time, if you require an emergency surgery, I'm a surgeon myself. I know if there is a cataract, I have to take it out and put in a clear lens for that vision to regain. But they very clearly describe, like I said, you know, the very basis, ayu, kya kehte hain, life.
Life.
The Veda is the study. The study of life is Ayurveda. They are not telling you that, okay, if there is an infected part of an intestine and until I don't resect it out and, you know, place a healthy thing, it will not get healed. So the clarity is, it's very, very clear. The demarcation is very clear. We are talking about chronic illnesses. We are talking about environment-related disorders. We are talking about lifestyle-related disorders. Now, not a single cardiologist or a CTVS surgeon would say that, okay, you take my medicines, I will do your surgery, but don't follow a healthy diet routine. Will not say that, okay, exercise. That is what Ayurveda is telling. It is telling you the way of life. The way of life that has to be incorporated in your day-to-day routine in order not to be sick. Of course, if you are sick and there is a parameter that needs a correction, that's what I'm saying. See, we are offering the two. We are not quarreling or competing between the two. I'm saying, okay, I'm the better one, you're the better one. No. We are beautifully combining them and offering the outcomes, the best of two. When I can get the best of two, why? So even if I'm treating a cardiac arrest patient and I put in a stent, you know, the PTCI has been done and everything, a stroke patient has been treated, but at the end when he goes for a discharge, because unfortunately he's reached that state, he has to rush to the ICU or the cath lab or for whatever procedure. But after that, when he's getting discharged, a counselor will sit with him and explain to him, sir, you had this. And why it happened, go and look back. The root cause, as science students, we've all learned that it's all about etiopathogenesis of a disease. And that is what a medicine is devised to work on. Most of our medicines, 80% of our medicines, I would say, in fact more, are actually derived from plant or animal origins. And that's what we are offering in Ayurveda. That something as simple as having an amla or something as simple as having a jeera or a methi ka dana, which we all have in all of our kitchens, if that can help me avoid a particular disease, why not do it? Why not adopt it in my lifestyle? Of course, when I'm reaching at that level, so that patient who's getting discharged, he's already taken an allopathic treatment, he's undergone a PTCA stenting. But then he and his family is counseled that, sir, in order to avoid this happening again, because say I've put in a stent in your arteries, can they not get blocked again? It can very well happen again. And it can happen to you, your family, your loved ones. So there is where that we find the opportunity that please tell them that we are giving you this option and now we are telling you that don't come back and again with the same thing.
Also, there is a blurring at many places because certain places are clearly demarcated, which are surgical cases, but we see people in real practice also because of commercialization where people will say that, okay, you know, let's say there's a kidney stone, you know, there's a homeopath treating, or they'll say, no, wait, they'll make them wait a lot of times, and I don't want to blame a particular, any system, it's just a blurring. I think for that also in the future, there is integrated health practitioners coming up, by the way, where even in the modern medicine system, they are introducing subjects that they are aware what all is included. That I think is very, very important futuristically, where everybody must be aware of all the subjects which are available, so that you know where to draw the line and where to further kind of give it to the other practitioner. Where do you refer? Where do you refer the case? No, even diabetes, for example, or any other lifestyle disorders, high blood pressure. So many times they are treated very well with other systems of medicine, barring the modern system. But where to amalgamate? So integrated healthcare practitioners are coming into being.
I totally agree with you. I have my team looking at me with glaring eyes and I need to stop talking. So we'll end this panel with a closing remark from Sir. He's been wanting to share something, but I promise this is something that can go for hours, and we'll not end it here. I promise that this session is going to be continued online on Zoom coming week. We will do with all of us on Zoom.
Just one line I will add.
Yes, ma'am.
When you talk of cancer patient or any patient, the patient alone is not in the hospital. There are people around him. They are the ones who are getting more mentally tortured than obviously the person.
Correct.
So astrology or the planets at that point of time can at least convince them. And they need more of stress busters than the
Absolutely.
patient itself.
Absolutely.
Because वो तो बेचारा ICU में आराम से लेटा हुआ है, जो बाहर खड़े घूम रहे हैं ना, उसकी लगती.
I totally agree with you. Sir,
With overpassing time, I have a lot of knowledge, experience and wisdom. There are three kinds of people in this world: those who are wise, those who are otherwise, and those who are supervise. I met late Mrs. Indira Gandhi 3 times, Urashi. I met Mrs. Gandhi 3 times in my life. These 2 simple pencils are doing an exercise where my blood flow to my blood is increasing. And I do this simple thing. So Madam Indira Gandhi, when she wanted to tell that the meeting is over, she will take a pencil and tap it on the table. That it's time for you to get out. Now this is the third eye. If you have migraine headache, just place it with this. Whenever I meet Urashi, I give her Ashirvad with Sahasra Chakra. This is for thyroid. This is your second brain. And this is your second heart. So there is scientific evidence growing that what I'm doing is science. Now, Harbinder, I just want to end with song of gratitude. Song of gratitude.
You're now connected to Boatstone.
Dr. Urvashi, you need to come in, join him. While we are doing this, we'll end this panel. Let this music be in the background.
Thank you so much.